9:16 in Washington, D.C. is where we find Senator Claire McCaskill this morning. Yesterday, Senator, we talked with your counterpart, Roy Blunt, so we thank you for spending a couple minutes with us today.
Absolutely. Pleasure to be with you.
Let's talk about the Affordable Care Act and healthcare.gov. When is the website going to be ready so we can start checking our health care?
Well, I think now people should go. Those people who do not have insurance through their employer should go now and begin checking it out. It is operational. It's not seamless, but it's operational. And importantly, you can get a phone number there that makes it pretty simple for you to call and talk to someone and get the information you need to begin shopping on the free market for insurance coverage that is where there's a competitive environment and variety of policies to choose from, a variety of coverages to choose from, various premium levels, and a lot more people as part of the pool, which, of course, is what brings down the price of insurance.
We're starting to hear quite a bit of criticism from people who wanted to keep their current plan are not able to, and them citing that President Obama said, hey, didn't he say I was allowed to keep my plan if I liked it?
Well, there is about 5% of the market that currently has individual policies, not through work. And about 5% have gotten some notices from their insurance companies on the individual market now, not major employers here,
right,
that say we are changing the policy because of the new rules of the road, which is, by the way, all benefit the consumers of insurance. They have to spend 80 cents of every dollar on health care. They can no longer just keep hiring more claims agents to figure out how to deny your claim. There's no lifetime cap on benefits. They can't tell you no because you had the nerve to be sick before. Those people are getting notices, but what they need to realize is there's a new market they can go to, a competitive free market that they can go to and look, and in most cases, they're going to find a variety of policies, and in many instances, they're going to find better coverage for the same or less money than they had when they were all alone in a fairly small pool.
There are some issues. Why not delay it for a year, get the website working perfectly, get all the kinks out of the system? What was such a bad idea about delaying it for a year?
Well, I think the problem is, am I the first to say this is embarrassing? Oh, yeah. And it's bad. I got to tell you, though, knowing I've spent a lot of time doing oversight on IT and government, and one of the problems we have in government is, unlike a large business enterprise, every single IT system has grown up independently of each other. So the system at Social Security was not designed to talk to the system at the IRS, and the system at the IRS was not designed to talk to the people at immigration. And you've got to have that integration in this because we've got to make sure that illegal immigrants are not getting the coverage. We've got to make sure that people qualify. We've got to make sure the subsidy rate is correct, the amount is correct. So this integration is what was really a challenge for them, and I think they oversold how well it was going to work. On the other hand, if you can pick up the phone now and be part of a larger insurance market right now, and for the first time maybe in your adult life get affordable insurance because you had a childhood illness, I don't know that delaying that is a good idea. The vast majority of Americans are not going to be impacted by these changes. And the vast majority of Missourians have not been impacted by these changes. Now, Missouri is much tougher than other states because the Republicans in Jefferson City were more interested in making a political point around Obamacare than allowing us to open an exchange. And by the way, the state's exchanges are working well. It's just the big federal one that's having problems. So if we had been able to open our own exchange and maybe go across state lines, which is allowed in this law, to partner up with neighboring states to make the pool even bigger, to expand Medicaid so you don't have this anomaly in Missouri where people make too little to shop on the exchanges because everybody in Jeff City was trying as hard as they could to prove how much they hated Obamacare.
It has been told to me that people who make above the poverty level get subsidized through all of these different subsidies, and then people below the poverty level, because Missouri opted out of the federal, people below the poverty level don't get any subsidies for their health insurance.
You know what's really weird about this is one thing that I'm always proud about in Missouri is our common sense. And this Missouri legislature led by a very extreme Republican Party. Not the majority of Republicans in our state, I don't think, but the ones who are the most active and passionate and therefore are running for office and controlling leadership positions. The common sense has just left the building. How in the world do you take federal tax dollars paid by Missourians and send them off to New York and California? How in the world do you say to hardworking Missourians? I watched that CBS nightly news where they had the woman who was living in a trailer, working an $11 an hour job, full-time, and she can't get health insurance because the Missouri legislature wants to prove to everybody how much they hate Obamacare, even though they're not going to be spending Missouri money for it. It's the federal dollars that are there for the taking. Billions of dollars that Missourians have paid in federal taxes are going to go to other states because of the stubborn hard-headedness of a political agenda. And I think it's terrible because real people are going to hurt in Missouri. And I said, why don't you call it We Hate Obamacare Medicaid Expansion? And maybe that would suffice. But rural hospitals will close. Our economy will be impacted. And hardworking people that are working hourly wage jobs, the working poor in Missouri, are going to continue to go to emergency rooms. But in the rural areas represented by Republicans, they're not even going to have a hospital they can go to. It's unbelievable to me.
Senator, there's been a lot of people who say that the law is not perfect, even Democrats, and President Obama said that if there's a good idea or two, he'd be happy to change it, massage it for the betterment of everybody. Is there something in the Affordable Care Act that you would like to see changed?
Absolutely. I would like to see us look at how many hours are part-time versus full-time. I'd certainly like to look at managed care and whether or not we're sure we're getting the right incentives in the right place, because obviously we're spending more money than every other developed nation with worse outcomes. And part of that is we have our profits siloed, and as we go to a managed care model, which is going to save us money and still have great outcomes, we've seen it in pilot programs around Missouri, that it's working. I want to make sure that the people in charge of that managed care are nurses and not just somebody who's hired to wield the axe in terms of cutting benefits. We're subsidizing unfairly some hospitals at the expense of other hospitals in an anomaly in the law that needs to be fixed. But the problem is the Republicans have not been interested in working with us to fix it because they've only been interested in destroying it.
Are you
and
worried?
That's what people forget, what the status quo was, why this happened in the first place. There wasn't a place I went. You should know, McGraw, when I campaigned in 2006, whether I was on a rural farm or when I was in the suburbs, no matter where I was, I said, what is the issue that you're most worried about? They said, we can't go anywhere to find health care that we can afford. So this was a problem we were trying to deal with. And Republicans are in denial that if we go back to the old system, we're going to continue to see escalating health care costs as far as the eye can see.
Are you worried that there are some employers who will not hire full-time people and or people who will stay part-time and or go from full-time to part-time because of this law?
Well, that's the talking point, but like a lot of talking points, like the myth that somehow we're exempted in Congress from Obamacare, it's not true. The data does not show. We had a spike in part-time employment as a result of the recession, because in a recession, what you do if you're an employer is you lay off as much help as you can, and you don't want to put full-time people back on the payroll until you're sure that you've got growth back in your bottom line. So you saw a spike in connection with the economic turmoil our country was in for 2008, 2009, going into 2010. Those numbers have leveled off. No one can produce any data, labor statistics, anyone that shows that there is an increase in part-time workers right now.
I'll let you go because I'm keeping you longer than I said I would, but last question for you, and here's the toughest one of all. What do you think in Boston tonight with Game 6?
Well, here's what I think. I think these are two teams that the home field advantage is not as big a deal as it might be with other teams. These are teams that I call, lunch pail teams, with the exception of Ortiz, who's been a beast. We don't really have, the marquee names. We have teams, and I think teams play as hard as they know how, no matter where they are standing or where they are batting or where they are catching. So Waka has been near perfection. A lot of pressure on him as a very young pitcher, but I love the fact that he was a draft pick in the Pujols debacle. I love the fact that he is going into Fenway in what is going to be a very hostile environment, and I think he's just going to pitch the hell out of the ball. And I think when he does, I think we're going to win, and then everything is up in the air for Game 7.
Can you call for a federal investigation to find out what was on John Lester's glove?
I'm pretty sure it was rosin.
Really? Because I thought rosin was a powder. I didn't know it was gel.
Well, it can get sticky. I mean, rosin is sticky by its nature. And here's the deal. If it was a big deal, I think the Cardinals would have said something. And I like the fact that the Cardinals organization said, you know what, we're not commenting on that. We're just going to go play baseball. That's kind of the ethos of our team. And my most disappointing moment of the season was whoever that frickin' lame brain was that flew a paper airplane onto the field during the World Series. That's not what we do in St. Louis.
Yeah, but you know what? Riding on that paper airplane, they were not using their cell phone, though.
Well, there's that.
Yeah. Where are we with that? Have you gotten the FAA off the back of the common, hardworking American so I can play my wordsmith on the phone while I'm flying?
Well, first of all, you're not common. Secondly, I would tell you that I am, in fact, yesterday I told my staff I want the FAA, I want that report. The report's been issued by this panel that was supposed to give them recommendations, and my information is telling me this report says open it up. There is no safety issue whatsoever. There's no reason for people to turn off their Kindles when they take off or land. They've not given me the report yet, and you can imagine I am anxious about it. So when I get that report, I'm sure you'll hear from my office about now it's time for the FAA to actually do what the report recommends.
All right. Well, if I were you, I would call for a federal investigation on Lester's glove. But we can agree to disagree, Senator.
All right.
Be
Fair
good,
enough.
Senator. Thanks for checking in, and go Cards.
Go Cards.
You got it. 9:28 here on the Big 550 KTR.